Good day po ma'am, I am Noy Magallanes po, your student nurse from Our Lady of Fatima University. So for verification po ma'am, may I know your name po? Kailan po yung birthday niya ma'am? November 11, 2000. And your age po? Okay, so what do you want me to call you po? Okay, so for today po ma'am Angel, I will be assessing your nose, mouth, throat, and sinuses po. And for me to be able to assess those parts, can I ask for your consent kung okay lang po ba na hawakan ko po yung certain parts of your body po? And also rest assured po ma'am na lahat po naman the documents and manunod ko po sa ating findings is confidential within me and between the attending physician that I will be referring to po. Is that okay po ma'am? Okay, so I already explained the procedure to you ma'am. Ngayon po, I'll be performing a hand hygiene po before we start the assessment po. And I give you some privacy po. And magsasot din po ako ng gloves. Okay, so I will going to assess your mouth po and any unusual findings will be followed up with the focus assessment. So for time to time po, I will be asking some simple commands and you should follow po. Okay po po ma'am? Okay po ma'am. I will start inspecting your mouth po. Okay. Pwede po ba tayo? Okay. So looking at your mouth po, it is symmetrical and your lips are pink. And can I touch your lips po ma'am? So, your lips po are smooth to touch and there are no lesions and also no edema po. And there is no bleeding as well. So, your lips po are normal. Now, let's move on to inspecting your teeth po. So, ma'am, could you smile po for me? Okay po, your teeth po are white. And can you please open your mouth po, ma'am? I use pen light po para po mas makita ko po. Okay po, so you have 27 number of teeth. There are no dental caries po. There are no dental filings. And your teeth po ma'am is well aligned. And there are no malocclusions or the overlapping of the teeth po. And also as I observed, you has a fresh breath po without any bad odor, which is good po. So next is I'm going to check your gums po ma'am. So could you open your mouth po ma'am? I use pen light again ma'am to check. Okay po. Okay, so your gums po are pink and it is firm without any evidences of gingival hyperplasia. It is not overgrowing and there are no any redness of gums po that may a sign of gingivitis. So overall, your gums are normal po ma'am. Now I'm going to check for buccal mucosa po. Ma'am, could you please open your mouth again po ma'am? Okay, so I'm checking for the side of your mouth. Okay po ma'am. Okay, so I'm checking po the side of your mouth or the buccal mucosa. And while checking, it is pink, it is shiny po, and there are no lesions. And there are also no swelling and no discharges as well po. And for the tongue po, I'm going to palpate your tongue po ma'am. Is it okay po ba na hawakan ko po yung tongue ninyo? And for the tongue po ma'am, I'm going to palpate your tongue po. Ma'am, is it okay po ba na hawakan ko po yung tongue ninyo? Using my hand po. And then I use this glass part para po mahawakan ko yung... Okay po ma'am, can you please open your mouth po? So, can you stick out your tongue po, ma'am? So, I'm gonna hold the gauze over here at the tip of your tongue. And ipapalpate ko po. Okay, so do you feel any pain po? Okay, so your tongue po has no tenderness upon palpating and there are no masses as I palpate po. And your tongue po is normal. And okay, so I observe po, ma'am, wala naman po lesions and there are no presence of ulcers po. This po sa assessing the tongue is that I'm going to check for the dorsal tongue and for the ventral tongue. Can you please open your mouth again, ma'am, and show me your tongue po? Okay po. Okay, so your tongue po, ma'am, is positioned in midline. it is in the center, and it is pink, and also it is rose po because of the presence of papillary. So next, ma'am, can you please put your tongue up po for me, please? Okay po. Okay, so for the ventral tongue po, it is a shiny and pink color. And it has a lot of veins, which is normal po, ma'am. So there are no evidences din po of mouth cancer. And as I inspect, there are no evidences of swelling, lesions, and any discharges is also absent. And also there are no presence of tongue tonic. Okay, so next, ma'am, I'm gonna check po for the strength of your tongue po. So just close your mouth and ilagay mo po yung tongue niyo sa gilid, sa side ng cheeks niyo po. Then ilagay mo po, ma'am. Okay, so sa kabila po, ma'am. Okay po. Next is the taste. We're gonna check the tongue's ability to taste po. So I have two different here. Okay, so as I observe po, ma'am, you can identify the taste po, and as I apply the tongue depressor to the side of your tongue, it can distinguish the taste, which is good po. And your tongue's ability to taste is normal naman po, ma'am. Okay, so next po, I'm going to assess your salivary gland, Wharton's duct. If there are no openings, and also we're going to check if there are any swelling or redness po. Okay po ba yun, ma'am? Can you please open your mouth po? Okay po, ma'am. As I observe po, there are no swelling naman po, and also there are no redness din po. Now, let's move on to the inspection and palpation of the throat. So, I'm gonna check po for the three things. First po is the uvula, the next is the gag reflex, or the pharyngeal reflex, and lastly is the tonsils po. So for the uvula, I'm going to check it using the cranial nerve number 10 test, or the vagus nerve test by asking the patient to say ah. And I will check po the elevation of the soft palate and the movement of the ovule po. So ma'am, could you open your mouth po and say ah? Okay po. So, as I observe po, there is elevation of the soft palate and movement of the uvula, which is normal po. And the color of the hard and soft palate are pink, which is normal din po. Next po is the gag reflex, pharyngeal reflex po. So, ma'am, I'm going to put the tongue depressor at the back of your tongue po, near the uvula. Is that okay po ba? Be uncomfortable po, so bear with me po, ma'am. Okay, since the patient has a gag reflex, it is normal po and there are no lesions, and the color is also normal. So lastly, I'm going to check your tonsils po. I'm going to use the tongue depressor and then the pen light po. Okay po. So your tonsils po are not inflamed and are in a normal size po, ma'am. Both sides are symmetrical and there is no evidences of tonsillitis. If the tonsils are enlarged, it may be a sign of tonsillitis. But for you, ma'am, your tonsils are equal. Your tonsils are equal and it is normal po. That's it for our assessment in your mouth po, ma'am. Next is the nose po, ma'am. But before we proceed to the assessment of the nose, I'm just going to remove the gloves and I will be performing a hand hygiene. Okay. So now, let's proceed to your nose inspection and palpation po, ma'am. Now, I'm gonna hyperextend your neck po using my ulnar aspect of my hand. Okay po, ma'am. So now, I'm going to push the tip of your nose po upward and shine a light to see if there is any swelling and change in color po. So, tell me po if masakit po yung nose nyo pag touch ko po. Masakit po, ma'am? Okay po. Okay, so as I observe po, the nasal mucosa and the turbinates is dark pink in color. And it is moist po, ma'am. And it is free from any accidents and discharges, which is normal po. And the septum is midline and well intact po. There are no swelling and there are no accidents and there are no change in color po in your internal layer or internal nose po, which is normal po, ma'am. And next, I'm going to palpate your nose po. So, I'm going to palpate your nose po, ma'am. Okay. So, as I observe po, when I lightly palpated your nose po, it has no tenderness and no lesions po, ma'am. Next naman po, we're going to determine the patency of airflow po. For both nose niyo po, so tatakpan niyo po yung isang nose niyo, then po kayo, ma'am. Yung kabila po. Okay po, ma'am. Okay, now I'm gonna start palpating the paranasal sinuses po, ma'am. So I'm gonna check po for the maxillary and the frontal sinuses po. So for the maxillary, I'm gonna press po using my thumbs, the both cheeks and simultaneously, and ask if there are any tenderness po, ma'am. Okay, so do you feel anything po, ma'am? How about in your frontal sinuses po? Okay po. As I observe po, there are no tenderness in both the maxillary and the frontal sinuses, which is normal po, ma'am. So, maganda naman po yung nangyari sa ating assessment po, and thank you so much po for your cooperation po, ma'am. Kung meron po kayong mga problema, ma'am, and question, kindly say it po sa ating attending physician that I will be referring sa inyo po. Kasi po siya yung mas knowledgeable po sa mga ganito po. So, thank you po, ma'am, for your cooperation, and have a healthy and a balanced diet, and also drink a lot of water every day po, ma'am. As much as possible, exercise din po tayo kahit unti po. Yun lang po, ma'am. Thank you so much.
Ito din.